I'm not going to keep you too long, but there's a few things that I've sort of written down on my pad as we've gone through today, which have really been kind of rattling around in my head, which maybe aren't things right now, but I sense are going to be kind of things for the future. So the first one was this came up in the commissioning workshop this morning. This idea, and I don't know if this is a throwaway remark or not, of evidence-based decommissioning. I think that's something that is really kind of lodged, and I think implicitly that as well as making the case for commissioning that is going to derive and drive benefit, I think the collective challenge that we're all going to face in the next few years is actually also going to be slightly more rigorous about identifying the areas where current services don't have the evidence to back up the benefit. I don't know exactly where we are with that in Bristol right now, but I think that is a discussion that is on the way, and we should keep it at the back of our minds. The other one is something which a number of people have kind of picked up, which is this kind of challenge of making the discussion about health in Bristol wider and engaging more people in that. I guess we've tried to kind of do our bit in some way in some of the events that we've run. I think actually that the work that you do in the HITs is kind of right at the sort of front line of that actually, and the PPI connected to all of the HITs drives that in a really sort of meaningful way. But I think that's again a sort of emerging theme about we have to kind of somehow manage to broaden the discussion and make it more inclusive and make it much more about the choices that we all face in and around Bristol and what health means, as opposed to just should we close the Kosher minor injuries unit, that sort of thing. So I think again that is a really, really big challenge. And then just this, I don't know, this really stuck in my mind, a phrase that you used, Joe. This data has been Bristolised. When you're talking about the JSNA, I don't know. I will look for opportunities to use that at any further opportunity. So thanks again for coming, most sincerely, and for all the work that you continue to do. I'm going to hand over to Jan now to announce the winners of our Partneropoly.
Great. I don't know if I can manage all of this. Brilliant. Okay, so
I'll take those.
That's a good idea. Thank you. Right. So thanks ever so much to everyone who got stuck in with the Partneropoly game. It was brilliant, and some really good suggestions for ways of collaborating in future. So in reverse order, third were the Ship Hit team, who earned £11,300 in just 30 minutes. Second were Stitch Hit, with £12,700. Well done. But overall winners were Shine with £14,200. So you win the gold trophy and a box of very healthy chocolates to share.
Okay, congratulations to Shine. Just before we finish, I of course want to thank the kind of core team of Bristol Health Partners who've all worked in a whole range of different ways to make this event happen. Obviously, our thanks, she won't hear this, but I'll pass them on next week, go out to Lisa, who wasn't able to join us, but just from my own perspective, I just want to thank everybody else in the kind of core team who's really kind of stepped up to make sure that today has been a great success. So thanks again to everyone. Enjoy your, and have a safe trip home. See you all again soon. Thank you. Ooh, I'd leave it all.